1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Pleasant day to everyone. For our webinar rules and regulations, let us find the place conducive for listening. Put your microphone on off or mute to avoid unnecessary noise and unusual sounds. Lend an ear if someone is speaking. Let him or her finish the statement before stating your point of view. For the question and answer portion, prepare your questions for the resource speaker and wait for the cue of the host on when to submit it via live streaming chat boxes. And observe online etiquette at all times. Good morning, everyone. Thank you for finding time to be with us today. I am Justin Valles, a Philippine Women's University Doctor of Philosophy and Nursing student, Assistant Professor of Nursing of De La Salle Medical and Health Sciences Institute. Before we proceed, I would like to inform everyone that we are live via Zoom and also on Facebook Live and YouTube. Please click share so that more of our nursing community may be with us this morning. To prepare ourselves for this morning's activities, let us begin with a short prayer to be led by the Ancillary Services Manager of Calamba Medical Center, Ms. Mariel Sevilla.
Let's place ourselves in the presence of the Lord. Dear God, we offer everything to you during this webinar. May we ask for your blessing and divine providence that the activities set for this undertaking be successful and effective. May we also retain the invaluable knowledge and learning experiences that we derive from this activity for actual application when we leave this platform. We pray that you bless all the committees in charge as well as the speakers, that they fulfill their tasks responsibly, that the objectives they have set may all be achieved. Your generous blessing would mean the success of this webinar. We know that without it, we can do nothing. May we be living witnesses of your genuine love through the implementation of the knowledge acquired through this activity. Kindly heal our land from this COVID-19 pandemic, O Lord. Grant us your divine wisdom as we go about our daily task after this webinar. This we ask in Jesus' name, Amen.
Thank you, Ma'am Mariel, for that very meaningful prayer. And now let us pay our respects to our national flag through the pambansang awit ng Pilipinas.
Kayang magiliw, pero saan sinanganan? Alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyat ka ng magiting. Sa manlulupig, di ka pasisiin. Sa dagat at bundok, sa simoy at sa langit mong bukaw. May dilagang tulat, awit sa paglayang minamahal. Ang kisap ng watawat mo'y tagumpay na nagtitingin. Ang bituin at araw niya kailan pa may di magdidinig. Lupa ng araw ng walhatit magsintabay langit sa piling mo. Aming ligaya dapat may mga abi ang mamatay ng dahil sa'yo.
So good morning once again. We are so happy with your presence and participation in this activity. Since we have started the program, we have already hundreds of people on Facebook Live, YouTube, and even on Zoom. These figures are already across our 3 platforms, so please do not forget to click like, comment your reactions and questions, and share this event so that more people may be within our reach. And now let us open our activity formally. May I call on an assistant professor of College of Nursing in De La Salle pa, and also of the College of Nursing in Pamantasan ng Lungsod ng Pasay, our dear classmate, Ma'am Mary Ann Neri.
Good morning. Thank you, Mr. Justin Valles. I'm Ann Neri, one of the committee head of this webinar. Good morning. Salamat pagi. Xiao Shang Hao. Magandang umaga. First of all, I appreciate your interest in exploring the opportunities in this pandemic period by joining our webinar, organized by the Doctor of Philosophy students in Current Trends and Issues in Nursing. All participants are hearty welcome to our program. We are so happy to see you together here, and we do hope that discussion on today's topic will be great and successful. And now for our webinar's objective. At the end of 2-hour event, the participants will be able to, first, identify the nurses' contribution in framing policies in nursing practice globally. Second, analyze the current crisis affecting the global nursing community. Third, articulate the current issues in nursing that contribute to the advancement of the profession globally. And fourth, describe the prevailing mental health concerns nurses face in practice today. I hope you will enjoy the session. Have a good time, and thank you for joining us.
Thank you, Ms. Neri. And now we approach our webinar proper. For the introduction of our welcome and inspirational message, may I call on Mr. Arvin Baez, Clinical Nurse Supervisor of Calamba Medical Center and Adjunct Professor of Nursing in the LaSalle Medical and Health Sciences Institute.
Good morning, everyone. Thank you for being with us today. We are very pleased to be able to welcome all of you to this international webinar from the School of Nursing Graduate Studies entitled International Trends and Issues in Nursing. We want to express our deepest gratitude to our inspirational speaker, our beloved President Marco Alfredo Benitez. This academic endeavor will not be possible without the support of our university president, the Dean of the School of Nursing, and the whole PWU community. Once again, let's give our warmest virtual applause to Mr. Marco Alfredo Benitez.
Dr. Felina Yang, University Chancellor and SVPAA, Dr. Minerva de Ala, Dean of the PWU School of Nursing, our distinguished speakers, Dr. Maria Linda Buhat, Dr. Marie Ortaliz, and Somana, and Dr. Jiayuan Zhang, our hardworking faculty, dear students and guests from the nursing community watching on our social media platforms. Good morning. Congratulations to the organizers, our students from our PhD in nursing program, taking up current trends and issues in nursing for another timely and relevant webinar. This time, bringing in prominent international speakers to share with us their thoughts and experiences on the current issues, challenges, and trends being faced by nurses and the nursing profession all over the world. 18 months into this global pandemic, where our medical practitioners are our primary frontliners in the battle against COVID-19, we have seen the many challenges facing our nurses, from staff shortages, longer work hours, risks to personal safety and health due to exposure from the virus, the extreme mental, emotional, and physical toll, and here in the Philippines, even the non-payment of proper wages and benefits. I can recall at least 2 occasions when the medical community had asked for a timeout, requesting for an extreme lockdown in the hope of slowing the spread of the virus, which had already overwhelmed hospitals and clinics with patients. And even one where many frontliners had recently gone on protest rallies to clamor for payment of benefits from the government. Without a doubt, this pandemic has also shed light on the great importance and tremendous debt humanity owes to our medical frontliners, especially our nurses. Most of them, ordinary citizens like ourselves, quietly going about their work, providing expert professional care to both COVID and non-COVID patients in highly stressful hospital environments. Most, if not all, are facing the most difficult challenge of their careers, and many have been at it almost nonstop for nearly 2 years now. This ordeal has exacted a profound toll on their mental, emotional, and physical well-being, and as many researchers have pointed out, on their professional identity as nurses. In addition to these challenges, the pandemic has also brought them face-to-face with complex moral and ethical dilemmas as a result of high levels of patient deaths, and at times a need to ration care due to the sheer number of patients vying for limited medical resources. These challenges are among the many issues and trends that we hope our distinguished speakers would be able to shed light on, discuss, and offer deeper insight into during today's session. Another area that I hope would also be tackled would be the changes and innovations to nursing education that have been adopted as a result of the pandemic and the absence of face-to-face classroom and clinical instruction, particularly with respect to virtual simulations. This would have great bearing on our own nursing programs here at PWU. Nonetheless, I hope that today's webinar further strengthens our appreciation for the importance of nurses and the nursing profession, with or without a pandemic. I hope it sheds light on the tremendous challenges they face and the sacrifices they make on a daily basis. And ultimately, I hope this awareness influences us to do our share in improving the nursing profession, either through advocating for better reforms or improving the quality of nursing education in each of our own institutions. Thank you very much, and may you all have a very informative session.
Thank you for that very heartwarming address to our virtual nursing community and for gracing us with your presence, our very own university president, Dr. Marco Benitez. And now we move to our keynote speaker. I would like to call on Mr. R.B. James Abonalia, Assistant Chief Nurse of Tri-City Medical Center, to introduce us to a remarkable and well-known figure in the professional nursing community.
Thank you, Sir Justin. Good morning, ladies and gentlemen. It's a great pleasure to introduce our keynote speaker. She has at least 38 years of experience in nursing management at the Philippine Heart Center. She started as staff nurse after a short stint as public health nurse. Prior to her appointment in the government, she also works in the United States and Canada. Aside from her experience as clinical and administrator, she also engaged in academe, having taught in graduate school since 1995. She was appointed to programs of Department of Health as chairman or member of different committee. She also actively involved in civic action and contributed to various categories in community development. She is a freelance consultant in quality assurance, person safety, infection and control, and nursing and hospital management, both locally and abroad. She is a multi-awarded professional due to her outstanding performance and contribution in nursing profession and human resource development. A fellow of Institute of Solidarity in Asia, and conducted several research studies, authored books in management. Please join me in welcoming Dr. Maria Linda Buhat.
Good morning, everyone. Thank you for the invitation. I'm very honored to be with you today. I'd like to start off, I'd like to share my screen. Can you see my screen?
Yes.
Thank you. I opted to have slides on this topic, although I'm supposed to speak as keynote, because I'd like to everyone to walk with me on the international trends and issues in nursing. I'd like to disclose that this presentation of mine, I don't have any financial interest presenting a conflict of interest to disclose. This presentation is a consolidation of the work of several authors, and these are my references. So to start off, I'd like to ask this question: what is the biggest challenge facing healthcare providers today? The biggest healthcare provider challenge is providing evidence-based, cost-effective, safe, and quality care that will improve patient outcome. The healthcare industry is fast evolving, embracing the fast pace of science and technology, among others. And with the effect of climate change, these challenges will not be easy to manage. There will be an expanding need for competent healthcare managers to lead the growing teams and facilities. With the changing technology and political uncertainty, healthcare leaders have to overcome several challenges. And I'd like to share with you the state of the Nursing Report 2020 by WHO. First is to invest in education, jobs, and leadership. Investment in nursing will contribute to health-related SDG, or the Sustainable Development Goals targets, but also, yes? but also to education, gender, and also decent work and economic growth. The workforce issues also has something to do with this. The nurse and population ratio by density levels, of course, in the Philippines and in other areas. 18 countries, as a matter of fact, is at risk of an aging workforce. Nurses and the boomers is retiring, and there are few young nurses entering nursing career. Equitable distribution and retention of nurses. And also, countries should strengthen capacity of workforce, data collection, analysis, and use. Using data for health, labor, mandate analysis, and guide policy development and investment decisions. I think you can relate with me that in the Philippines, we really don't have sufficient data, and they are more on close accuracy on the data to guide us in the policy development. The nurse mobility migration must be effectively monitored and responsibly and ethically managed. WHO Global Code of Practice on International Recruitment of Health Personnel by Countries there are list of standards that each one of us, each country has to follow. And for your information, the Philippines is also following the standards of the WHO Global Code of Practice. But sometimes, you know, in other disciplines, hopefully they're not nursing, there is violation on the standards of the WHO. Nurse education and training programs must graduate nurses who drive progress in primary health care and universal health coverage. So these are the specialization program like the nurse practitioner. The curricula, however, must align with national health priorities as well as emerging global issues to prepare nurses to work effectively in interprofessional teams and maximize graduate competencies in health technology. Nursing leadership and governance is critical to nursing workforce strengthening. Policy dialogue that results in evidence-based decision-making on nursing workforce. That's why in leadership and governance, research is important because we have to consider not only the multi-generational workforce, but also the science and technology that is coming fast. The planners and regulators should optimize the contribution of nursing practice. One of that is the primary healthcare working in full scope of practice, primary healthcare working in full scope of practice. What I mean here is the control over practice of nurses, the independent function, especially on the primary care. The nurse-led models, we have a lot of models, and the advanced practice roles, like the advanced practice roles of nurses, that not only on vertical career path, but also horizontal career path. Policymakers, employers, and regulators should coordinate actions in support to decent work. Here, it's the positive practice environment of nurses. Positive practice environment is not only salary, it's also the decent workplace. You know, we should have a lounge for our nurses to stay during their break. That is a requirement by international accrediting bodies. You know, it's the place where to eat. You know, and of course the nurse-patient ratio and the needs of the nurses. There are many things that considered in positive practice environment. The countries should deliberately plan for gender-sensitive nursing workforce policies, equitable to gender-neutral system. In the Philippines, I don't think we have a problem with this because we have recognized male nurses in nursing, but in other countries, it's still dominated by female. So the professional nursing regulation must be modernized, harmonizing nursing education to credentialing standards. We have the certification on competency, and this should be given a credential by the Board of Nursing. And I think the Board of Nursing now is working towards this to adopt also and to align with ASEAN qualification framework. So we have identified the Philippine qualification framework, and the Board of Nursing and other leadership is also working on this. Like we also have the CPD. Collaboration is key. The intersectoral dialogue, a key element to strengthen capacity for effective public policy stewardship. Collaboration, actually. So do we have a voice in the policy development? Do we have a voice in regards to nursing workforce? So the primary health care should be strengthened to achieve the universal health coverage and advance towards the Sustainable Development Goals. And this is the 17 sustainable goals, which I have mentioned earlier from the WHO, and we have to work towards obtaining this goal. I remember we have a competitive clusters, and number 5 of competitive clusters is the health cluster. And I was involved in few times in the development of the health cluster, looking onto the competitiveness of the Philippines with other countries. And we fall short in most of the areas, but those who were assigned to work on this, like the Department of Health, is working hard to meet the goal. So now, to saying those, I'd like to identify the trends and issues in nursing education. The socio-demographics, cultural diversity, economic and political changes, and global issues. Like the diversity is very important, and also the economic and political changes. The use of technology and informatics, as of now, we don't see it face-to-face or in person, and we use the technology, the online, and any platform that we reach each other, especially in education. Evidence-based practice and practice-based competency outcome is the trend now. So the curricula should also be aligned to be a evidence-based practice and the practice-based competency outcome. I remember that in research, of course, the practice or the practitioner should do the research because of the new technology and the new practices in science. And this research should be also shared with the academe. The academe now will teach the students. So when they graduate, they are now ready for work in the hospital or in any healthcare facility. And the performance-based competency learning and objective assessment methods, this is a new trend in also an issue in education, and community focused by interdisciplinary approach. The patient-centered care, or what we call now by WHO is the people-centered care, the engagement of people, safety and the privacy issue because of the Privacy Act also has an effect in education. The ethical and bioethical concerns, and the increasing shortages of nurses, especially also the faculty in school, because of as I have said, the boomers who are not very techy or technological savvy retires and you're getting new one, and you just have to, the education is also important in teaching. So disasters, the violence and terrorism, like now we are having a pandemic because of this COVID-19, and this affect our educational system. The increasing personal and professional responsibility, personal and professional responsibility. What I mean here is not only the mental health of the people, but also the learning, continued learning activities. Okay, before the traditional approach, objectives with closely orchestrated training experiences, it's a faculty control. But this time we have competencies and outcomes focus on end product. The faculty and the student collaborative learning process. So it's a dual thing wherein the teacher and the students share and collaborate with each other for the learning of the outcomes. The deeper understanding of non-cognitive skills to promote a more holistic cognitive and socio-emotional development experience. And so the skills is emphasis on three things: social skills, communication skills, and adaptability skills. As a practitioner myself, we need the graduates to easily adapt on the environment of work. And so it's also a student-centered centric. The trends in nursing issues and in nursing practice, of course, has an effect also in education, and the same manner the education affects also the practice. One factor now is the telehealth or the technology and privacy concerns. Everything is biotechnology, and the privacy because of the Privacy Act. And in nursing practice, this is very important because we have to disclose, but we have also to consider the law and the privacy. The increased specialization, increasing clinical practice complexity because of the science, and also the nurse practitioner practice. In the Philippines, we don't have yet a nurse practitioner practice. As I have mentioned earlier, we have also certification of competency from the government, like the Department of Health is certifying nurses who have been competent, like for example, cardiovascular or orthopedic or trauma, infectious. They have at least 12 specialty being certified by the government, that it's the Department of Health. The certification is level 3, 4, and 5. The 5 is the expert. And on the other hand, other organization like ANSAP is also certifying level 3, 4, and 5 for nurse managers or nurse administrators. And this should, in my own thinking, this should be given a credential by the Board of Nursing for control. The primary health is very evident in us. We have wellness, we have the spa, and the nurse navigator. The nurse navigator may be new to us because of universal health care, and there are already nurse navigator in other countries. The changing healthcare delivery system, especially the post-pandemic, because we have a lot of detractors during the pandemic, and we have to redesign the systems. We have to redesign policy to be able to respond effectively to the needs of the public. Okay, we also have the increasing need of higher education, like the master's and doctoral education competency, certification, and credentialing. I have mentioned about the competency and certification, also credentialing earlier. And now the position, if you want to go up your career path, both horizontal and and vertical, you should have a higher education like master's and doctoral education. Online education for formal and informal. What I mean of formal is like what you are doing now, and informal actually are the updates or the needed continuing education by practitioners. The workforce shortages, I have mentioned that earlier, because of the boomers who are getting away of practice, not only because of age, but also because of pandemic. We have a lot of nurses in other countries that has left nursing because of the pandemic, of the COVID-19 scare. As a matter of fact, in United States, nurses cannot retire, even if they want to retire, because of nurses. The generation workforce concerns, which I have mentioned earlier, that there are different traits and characteristics of each generation, and we just have to look onto this, consider this in our policy development, and integrate it into the system. The self-care. What I mean of self-care and negative affectivity is the mental health. Before, we have neglected the mental health of our people, but this time mental health is important because it affects really not only the person, but also the productivity level when they work in the hospital or in any healthcare facility. The emerging and re-emerging of infectious diseases, like the COVID-19, we have a lot of variant already. And we have also those that has we resolved already, but re-emerged again because of the climate change. The ethical and bioethical issues, the workplace violence, and this is very evident up to this time, not only in the Philippines, but in other countries as well. Nurse to nurse bullying, first line manager or unit manager or head nurse bullying a staff nurse, supervisor to supervisor, bullying from other disciplines. And this is very evident in any workplace, and this has to be stopped. The enhanced nurse licensure in the compact, the ENLC, established in United States in 2018. This makes the nurses to work across state lines. So it simply means if you are licensed in Florida, you can work in California or in New York. Before, you cannot do that. In the Philippines, we don't have that practice yet because we only have one licensure for countrywide. Patients and public becomes more educated. Why? Because of technology, probably. They just Google and they know more about their disease and illnesses. So it's a push and pull for the healthcare people, especially nurses, to know really and be knowledgeable of what we do, because our clients are already knowledgeable of what we do. So there are top 5 challenges in summary of what I have mentioned: the healthcare cost, healthcare policy, technology, workforce shortage, and leadership gap. In healthcare cost, this is about the reimbursement. We have heard about the reimbursement of the work of nurses in the field health. In other countries, reimbursement also is an issue. Several models are being tried, shifting and from the fee for service based model to a performance based model. This means that the provider fee is based on the quality of service, delivered, and the clinical outcomes. This needs a fundamental changes in the way they do business. In healthcare policy, The UHC, or the Universal Health Care implementation and compliance. Most of the hospitals has not complied this. In other countries, it's also the same issue and concerns in the nursing profession. Healthcare providers need to adapt quickly to any changes that might come about in healthcare policy and regulations. So it simply means that policy and regulations in healthcare is fast evolving. They change, and we just have to be in the racetrack so that we can be at par with the expected outcome to this profession. Technology is one factor that is the trend now. One of the most significant changes within the healthcare industry is the emergence of technology. Driven by growing demand for personalized medicine, these technologies are increasing the costs and complexity of healthcare. So therefore, healthcare leaders needed to be competent and also comfortable to understand, assess, and evaluate what kind of technologies to purchase and how we will be able to use technology. They have to be, the technology has to make the business decisions about the right tool, change the systems to acquire and implement. Adaptation to change by the health providers, as well as hiring and training the right staff, is also important, because right person to the right job is a rule of management. In workforce shortage, I'd like to mention this, that currently the healthcare industry is facing a growing shortage of skilled and qualified workers. The leaders, therefore, must learn how to attract, retain talents. In the Philippines, it's so ironic that we supply nurses all over the world, but at this time we are short of nurses. Why? We have identified several factors why nurses is leaving the nursing job. Not only the pandemic, not only the salary, but I think more of the working conditions as well. There is also the leadership gap, which I have mentioned. The huge gap of leadership governance in managing the challenges in healthcare industry. What I mean of the leadership gap is that the nursing leaders, do we have a voice in the government? Are our concerns and issues, needs, are being considered in the policy development? In other countries, they already have nurses' voice in the government, but few countries like us, we still do not have this. And in my observation and in my work as a nurse for a long time, I have noticed that image in nursing is very important. What is our image in the Philippines? What is our image in other countries? In the Philippines, I would say we still have to improve the image of nursing. You can see that in movies, you can see that in the soap opera on how they treat nurses. And I have a personal experience when I worked, when I still active in practice and negotiate with the DBM for the salary of nurses, negotiate with the DBM for the nurse-patient ratio. And I can feel that they really do not see nurses as an important member in the delivery system. They always say, You are only an assistant of the doctors, which it's not true. So therefore, the image you and me has to improve, has to be assertive enough to influence people, the general public, and other multidiscipline team, so that we will be recognized by the government and the public itself. So how to overcome that? This is a personal overcoming challenges. Think positive, or as a leader, have to think positive as well. We think positive, we reconnect to our body. Reconnecting means, be aware of what is going on and adapt the change. Work on health change, accept the change. If we need the mental health, then go for mental health. If, we know better ourselves. Time management, because of the complexities in the work area, we just have to manage our time, and also to be very productive. Have a break, spend time with your loved ones. That's why in shifting or in scheduling, this should be considered by nursing leadership, that we cannot be very structured in our scheduling and shifting and staffing. We consider also the humanness and the needs of the individual nurses. We have to relax, socialize, and as leaders, we have to provide this to our people. And their relaxation and socialization, it helps them, especially in their mental health and in retention and motivation factor. We eat and sleep well. I remember one chief nurse is saying that their nurses doesn't even have the time now to eat snack or meal time, lunch or dinner. And I feel sorry for that, because this should not be allowed by the nursing leadership. And of course, pray, because that is the most important. So nursing as a career is demanding, but rewarding. And I hope you will agree with me when I say we have to embrace these challenges. The issues and trends is on. We just have to accept that, embrace, overcome it, and move on, because that is life. So if we are growing, according to John Maxwell, we're always going out of our comfort zone. Thank you. I can answer questions if there are questions. Thank you.
Thank you, Dr. Buhat.
Mm-hmm.
Yes,
Can I stop sharing now?
Yes, Dr. Buhat, you may. Thank you so much. So thank you, Dr. Buhat, for that very heartwarming address. Thank you for your advices to our fellow nurses. And now we are actually going to move on first before we go to our question and answer portion. So kindly prepare, guys, your questions for Dr. Buhat later during our Q&A, and kindly comment them on your YouTube and Facebook comment section. So now we have our international resource speakers. So we have actually 3 of them this morning. To start, may I call on our classmate, a nursing faculty from Budiluhur Institute of Health Sciences, Mr. Ando Fikri Hakim, to introduce our speaker from Indonesia.
Okay, good morning, everyone. Thank you, Sir Vlad. Let me introduce for the speaker from Indonesia. For the name of speaker is Mr. Somana. He is Master in Nursing from Burapa University, Thailand, and Master of Education in Indonesian Education University. He is Professor of Mental Health in Budiluhur Institute of Health Sciences. His expertise also in mental health in nursing. Then he is as an accreditor in Independent of Accreditation Board in Indonesia. Now, the present Mr. An as head of BSN study program in Budiluhur Institute of Health Sciences, Indonesia. He also as a consultant and early detection of mental disorder in Public Health Center of West Bandung District. Let us welcome to Sir Aan to join with us as a speaker. Please, time is yours, Mr. Aan. Thank you. Muncul Pak. Lagi loading.
Or Sir Michael Justin and Sir Ando for the times. Can you see my screen?
Yes, sir.
Okay. Good morning, everyone. Magandang umaga. Today, I am very pleased to be invited and to meet you all to share about trends and issues in nursing. In this seminar, I would like to share for specific topic about trend and issues of health mental nursing in Indonesia. Before I deliver material on trend and issue in nursing, first I would like to introduce a little bit about Indonesia and mental health cases in Indonesia. How I cannot move screen? Sharando. Cannot move my screen. So, ladies and gentlemen, I cannot move my screen. Maybe stop share first. Okay, continues. This is our country, Indonesia. As you know, Indonesia has a high population. Oh, sure, Ando. Okay. Indonesian population more than 2053 million people, and we have islands more than 13 islands. And our ethnicity also more than 1,000, and we have languages, local languages more than 400, and we have one national language, Indonesia. And about religions, Indonesia, we have 5 kind religions: Muslim, Protestant, Catholic, Hindu, Buddhist, Konghucu. And then okay, this is the proportion of household with schizophrenia, mental disorder, or psychosis according to profit per meal in 2013 until 2018. You can see in this chart in 2018 higher the number of 7. Okay, this is the proportion of households with schizophrenia mental disorder or psychosis who cycled according to the resident in 2013 until 2018. We can see in the chart on the left the number of cases of schizophrenia that have been cycled in rural area is higher than in urban areas. However, in 2013, it was 18.2 per mil. It decreased to 17.7 per mil in 2018. Furthermore, you can see on the chart on the right in 2018, the number of schizophrenia patients who were confined in the last 3 months in rural and urban area was the same, namely 31.1 per mil. The first circle on the left, we can see that the number of schizophrenic patients who received treatment was more, which amount to 84.9%, and only 15.1% did not receive treatment. And the second circle, we can see the number of schizophrenia patients who take medicine irregularly more than regularly. And on the chart on the right, you can see the recent schizophrenia patients do not take medicine regularly, mostly because the patient feel healthy. This is the prevalence of depression in the population less than 15 years old, according to province. In 2018, you can see the red color in the middle. Indonesia, the number of depression patient 6.1, and the right side, you can see only 9% of people with depression are taking medicine and medical treatment. Okay, this is the prevalent mental emotional disorder in the population less than 15 years old, according to province in 2007 until 2018. You can see in the chart, in 2018, we have the number of the mental emotional patient 9.8 per mil. This is a mental nursing problem in the hospital. In Indonesia, we have actually we have more problem, but the higher problem first, we have patient mental nursing problem, perceptual disorder, hallucination. What is the hallucination mean? That is change in sensory perception, feel, false sensation in the form of sound, sight, taste, touch, or smell. The patient feel a stimulus that is not actually there. Hearing hallucination, that is the patient say he hears a sound that doesn't actually have an object. And the second visual hallucination, that is the patient see an object like a pupil object, etc., that are not actually there. The both of these problem in the hospital we can found higher. And next, third, smell hallucination. That is the patient smell something that not actually have an object. And fourth, taste hallucination. That is the patient feel tasting something in this mouth, even though there is no object. And the last, touching hallucination. That is the patient feel uncomfortable on the surface of the skin, but there is no object. such as feeling an animal, feeling hot, etc. Of all of them, the case in the hospital we can found it. And the second, we can found mental nursing problem in the hospital, thought process disorder, delusion. Delusion, that is a false belief that is maintained strongly or continuously but not in accordance with reality. We have 5 kind of the delusion. First, delusion of greatness. That is the patient believe that he has greatness of special power, is spoken repeatedly but does not match reality. And the second, suspicious delusion. That is the patient believe that there is a person of group who is trying to harm or injure himself. Is said repeatedly but does not match reality. The both of this case in the hospital we can found more than another case. And to reality. For, sorry, Bex. Somatic delusion, that this patient believe that his body or body fat is disturbed, affected by disease, spoken repeatedly but not according to the reality. And the last nihilistic delusion, that is the patient believe that he is no longer in the world or die instead repeatedly but does not match reality. The 3 case in Indonesia we can found in the hospital, but not more. And the last, we can found also in the hospital, mental nursing problem, low self-esteem disorder. That is feeling what worthlessness, meaninglessness, and prolonged low self-esteem due to negative evaluation of oneself and one ability. And another, we can find mental nursing problem also in the hospital, social isolation disorder. That is a condition in which an individual experience a decline or is even completely unable to interact with other people around him. Patient may feel rejected and accept lonely and unable to form meaningful relationship with others. And next, violent behavior is disorder. We can find more in our hospital. That is a form of behavior that aims to injure someone physically or psychologically. Based on this definition, violent behavior can be carried out verbally, directed at oneself, other, and the environment. Violent behavior can occur in 2 forms, namely during ongoing violent behavior or a history of violent behavior. And also, sometimes we can find in the hospital and in the community suicide disorder. That is the risk of action that are consciously, deliberately taken by the patient to end his life. Based on the magnitude of the patient's likelihood of committing suicide, we recognize 3 types of suicidal behavior, namely suicidal choice, suicidal threat, and suicidal attempts. And the last, we can find also mental nursing problem, usually in all case mental health in the hospital or in the community, self-care deficit disorder. That is lack of self-care in patient with mental disorder occur due to change in thought processes to that the ability to carry out self-care activity decrease. Lack of self-care can be seen from the inability to maintain personal hygiene, eat independently, decorate independently, and toileting independently, urinate and defecate independently. And now, this is a mental nursing problem in the community, not in COVID-19 pandemic condition. We have find 5 cases. First, anxiety. The second, losing, grieving, and our third, helplessness and despair for spiritual distress, and the last, post-traumatic stress disorder. And in COVID-19 pandemic condition, we can found in the community mental and psychosocial nursing problem more than the hospital. Yeah. First, anxiety, body image disorder, situational self-esteem, helplessness, despair, spiritual distress, social isolation, losing, and grieving. And how about handling action of COVID-19 patient? We have three kind of action. First, immunity enhancement include physical immunity, mental immunity. And the second, prevention of health problem include prevention of transmission, self-isolation at home, and mental health problem prevention. And the last, isolation in the hospital. And physical immunity enhancement, we need nutrition food, drink enough, exercise at least 30 minutes a day, sunbathing in the morning, and rest enough. Improve mental health resilience. Everyone, we should be relaxed physically, positive emotion, positive thinking, positive behavior, positive relationship, and the last, positive spiritual. Prevention of transmission, self-isolation at home, especially for physical. In Indonesia, we have regulation as long as pandemic COVID-19. For everyone should be social distancing, physical distancing, wash hand, use a surgical mask all the time, stay at home, clean up the handphone. The patient is placed in a spirit room. Personal necessities are separate from other family members, cutlery, toiletries, clothes, and bed. And also, we need education, family education, how to care at home, and regular checkup by health workers. And next, prevention of mental health and psychosocial problem in individuals. We can found two kind of reactive attitude. First, reactive attitude. Reactive attitude mean we can found symptom of the individual, quick reaction, then aggressive, anxiety, and panic. For example, the individual more buying food, mask, hand sanitizer, vitamin, etc. And the second, we can find responsive attitude. For the symptom, this patient show to us calm, measured attitude, finding out what to do and giving a appropriate and reasonable response. Breathe, assess, action, reflect, we call BAR. And for reactive attitude, there is no recommended for us. How about BAR? BAR, first, breathe. Breathe means take the time to take a deep breath, set quietly to think what to do, which is useful and not excessive. Assess means ensure the information obtained is valid and from trust sources. Avoid false information if you are going to share information, filter and check for correctness. Action means take action in accordance with official recommendation from the authorities, continue to carry out risk assessment and remain calm. And the last, reflects mean reflecting and evaluating what has been done, assessing the current situation and preparing for the next response to be taken. And now prevention of mental health and psychosocial problem in the family. We have kind 5 of action. First, knowing the problem. Second, make decision. Third, caring for family members. Fourth, creating conducive family atmosphere. And the last, using health service facilities. And this screen, isolation in hospital. Physical nursing care, we must caring to the patient with hyperthermia, ineffective breathing patterns, ineffective airway clearance, and effective activity intolerance. And the second, mental health and psychosocial nursing care. Yeah. We must caring to patient with problem, anxiety, body image disorder, and situational low self-esteem. Nursing Action Health Officer during the COVID-19 pandemic. First, prevention of COVID-19 transmission. Carry out the same transmission prevention measure as the general public, equipped with first, wear the professional protective equipment, PPE. How to use and remove PPE must be done according to the standard operating procedure that has been set to minimize the transmission of COVID-19 to nurses. Nurses must carry out no PPE, no nursing services. The second, independent early detection. If symptoms are found to point to COVID-19, immediately report and carry out an examination. And the last, self-isolation for 14 days after treating COVID-19 claim. How about prevention of mental health and psychosocial problem? Take the same mental health and psychosocial prevention action as the general public, equipped with stress management while on duty. Do it every time you have a break. Nursing schedule. Alternately carry out to reduce nurses' anxiety because they have to be near COVID-19 clients. The length of time to care for a COVID-19 client is a maximum of 4 hours for one nurse. fear of being infected. Stress management is carried out when leaving the COVID-19 client treatment room, which can be done. Isolation and separation from family, communicate through online regularly to get psychosocial support from family. And the last, stigma management, also important for us, self-stigma and social stigma. What is the self-stigma and social stigma? Self-stigma, stigma that a fear of nurses labeling themselves as someone who can infect other, worries of being ostracized, lineaged by family members, friends, and society that nurses might feel. Similarly, the family might feel the same way, worried about being isolated by neighbor, relative. For this reason, education regarding the meaning of recovering from COVID-19, the possibility of transmitting or reinfecting it need to be explained to the public. And next, what is public stigma? Public stigma is a real action by others who label nurses and their families as dangerous to transmit COVID-19. In some cases, nurses were refused to go home by the community. The community's refusal of the funeral of nurse who is grieving due to COVID-19, the head of public figure for fear of spreading the coronavirus. For this, is necessary to educate the wider community so that there is no rejection of nurses caring for COVID-19 client and bodies confirmed by COVID-19. Next slide. And nursing action on health of officers during the COVID-19 pandemic, strategies to reduce public stigma. First, protest. Protest means protest to media. Stop reporting inaccurate information to the public, and to public also campaign the positive aspect and the patient right. And the second, education, public awareness by community education. And the last, contact with COVID-19 patient, testimony of patient and healthy workers in the process of treating COVID-19 and staying healthy. Next slide. Strategies to reduce self-stigma. Protest and anger to the stigma for patients of COVID-19, active in care and treatment. And the second, actively encourage a quality healthcare system. And for health workers, first, continue to treat COVID-19 patients. The second, testify how to take care of the right and not infected. And the last, proud to be a health worker who treat COVID-19. And the third strategy is to reduce stigma by stakeholder. All people who have power or influence in society become anti-stigma perpetrators, health worker, government official, law enforcer, journalists, politician, hamlet, neighborhood, religious leaders, public leaders, traditional figures, etc. Okay, this is my presentation. I hope you get benefit. Thank you so much for your attention.
Thank you for briefing us on the current concerns of the nursing profession in Indonesia, Professor Somana. And now for our second resource speaker, may we ask our dear classmate, Ma'am Maria Socorro Lanzar Castillo, to introduce us to a Philippine nurse leader based on the United States of America.
It is a great honor to introduce one of our resource speakers for this morning, a dear friend of mine and alumna. Her humble beginnings began when she earned her Bachelor's of Science in Nursing from Colegio de San Agustin in Bacolod City, Negros Occidental. After she graduated, she emerged as one of the top notchers of the nurse licensure in the Philippines way back in 1975. She finished her master's degree in healthcare administration in 2010 and completed her Doctor of Education degree in higher education administration in 2014 from the New England College, New Hampshire, USA. She also finished the Global Health Delivery course of the prestigious Harvard University in 2018. Her professional experience includes various roles encompassing clinical manager in clinical units, critical care clinician, cardiothoracic clinician, and nurse educator and professor. She was inducted to the Sigma Theta Tau International in the Leadership and Research category in December 2012 and a fellow of the New York Academy of Medicine in November 2019. She has lectured nationally and internationally through the Philippine Nurses Association of America and recently served as a distinguished international academic speaker in the World Congress 2021. The Future of Nursing 2021, sponsored by Piers Alley Media Canada. She has an active voice in supporting legislation that promotes nursing education and nursing welfare that made her earn the Atlas Award from the Philippine Nurses Association of America in 2019 and appointed to the End Nurse Abuse Panel by the American Nurses Association in 2018. The most remarkable of this is that she is the founder and the president of an organization of her namesake that focuses on continuing education for nurses. She is the executive and managing director of Westchester County Filipino American Nurses Association of New York and the immediate past president of Philippine Nurses Association, New York. Today, she's celebrating her special day, and in behalf of our class, we would like to greet you a happy birthday. Ladies and gentlemen, come and join me. Let us all welcome multi-awarded nurse leader, Dr. Marie Antoinette Ortaliz.
Thank you so much, Maria Socorro, for that generous introduction. Yes, so I'm going to share my screen and hope I do it right. How come you cannot start screen share? Oh, what other participant is sharing? Maybe somebody has to stop screen share. Is that what it is? Let's see. All right. Somebody has to stop screen share though. Let's see. Share. Oops. Thank you so much. Well, good morning, Philippines, and good evening, New York, United States, and good afternoon, perhaps other countries of the world. I am so excited to present, for the Philippine Women's University PhD cohort, and this is a great opportunity. But, most of the problems that you have are almost the same problems that we have. So the title of our lecture is Current Trends and Issues in Nursing. And I have this picture here, and I'm going to talk about each one of them. So the first one is the nursing shortage, as was discussed earlier by Dr. Buhat, our keynote speaker. So in the United States, we are experiencing a big shortage, but the shortage has existed way back in the 1960s, when the United States have recalled nurses in the Philippines, those nurses who were here due to the exchange visitor program, and they went home. Well, the hospitals in the US realized that they needed nurses, so they had to recall these nurses. But currently, the shortage, according to the Health Resource HRSA, is that we are going to experience from now up to 2030, we're going to experience a 1.1 million shortage of nurses. That is a lot. Now, for the world, the statistics is 5.1 million from now through 2030. So the problem is not only the United States or the Philippines, the problem is global. So with COVID-19, the problem has been aggravated because people have died. Our healthcare providers have died. I have a school of nursing. I have a school for continuing education in New York, and I do send letters to nurses to remind them to renew their certifications. Sometimes I get the letters back saying that that nurse is deceased. Isn't that sad? And sometimes some of them are my Facebook friends, and I do receive letters from their families saying that they have passed away because of COVID. So that is really aggravating the nursing shortage. And because I'm from the Philippines, I'm going to talk about the Philippine perspective, right? So on COVID-19 deaths, there are 150,000 Filipino nurses in the United States, and we make up 1/3 of the migrant nurses here. That's including all the ethnicities. We make up 1/3. And the Filipino nurses in the United States represent only 4% of Filipino nurses. But out of the 4%, 30.9 of Filipino nurses have died, 30.9 deaths. So another problem that aggravated the shortage is, of course, the deaths of the nurses, right? And that aggravated it. And many of the nurses who were talking about retiring in 3 years or 4 years from now, they actually took the opportunity to retire early because of the fear of COVID. And so that actually aggravated the shortage. If you think about it, the critical care units, the mean age or the average age of nurses in critical care is like 47.5 years. So nurses are up there in age, and many of them are already just burnt out and ready to retire. So the next problem here in this pyramid of problems is faculty shortage. Faculty is required to have their doctoral degree in the United States. And for those who have their master's, they are clinical faculties, meaning they follow nurses in the hospitals to supervise them. But those who are in charge of theory, like classroom teaching, they have to have the doctoral degree. But how many nurses have the doctoral degree? Not many. And that for that reason, the schools have a very big vacancy, big faculty shortage. Because of the faculty shortage, nurses who are going to be admitted or who want to go into nursing school, they have to wait. So they're waiting in line because there's no place for them. No faculty, then no students, right? Because there has to be a faculty to student ratio. So that's one of the main problems also that we have. Another problem in this pyramid, see, I only have a few slides, so I'm glad about that because I can talk more about it. The credentialing. Nurses, when they came to the United States, Filipino nurses or other nurses from other countries, when they come to the United States, they realize that this is the age of credentialing. So they realize that there's a broad spectrum of specialties that they can go into. So you have, years ago, it was the generalist, you call them general nurse. These nurses are med-surg or staff nurse, but that does not exist anymore. Because when you say a staff nurse, they could be a staff nurse of a neuro unit, an ICU unit, they could be staff of cardiothoracic, cardiovascular, CCU, radiology, all these specialties that spring up. And the reason for that is because nurses have been advancing in their knowledge. And as you advance in your knowledge, you find out that you learn more about research and medicine, and research is evidence-based. So the hospitals, when they constantly do their policies and procedures, they always follow what research, what science has presented, such as evidence-based research, and this becomes the knowledge base for each particular unit. So nurses have become specialists, and because they're specialists, they actually want to be credentialed. So they are credentialed people. So that is another, it's not a problem, it's a plus. It's not a problem, but since we're talking about current trends, that's the current trend. It's the age of credentialing. So the next, and there are credentialing requirements. So the next one is incivility, workplace violence. This is a never-ending problem. So the American Nurses Association has actually come up with a panel. In 2016, I was one of the panel of the ANA or ANA, and the name of the panel was End Nurse Abuse Panel. And there were nurses from, I was one of the nurses in New York. There were nurses in all 50 states, and we spent time discussing, online, discussing what are the problems, why do we have incivility, workplace violence, and the nurses had to be interviewed, for this. We had to gather data, and there was so much data about nurses saying that they feel that it's part of the job. Well, it's really not part of the job, right? So incivility and nursing and violence should really be avoided. And why? Because if the nurse is not happy, if this is happening, what will be affected? Of course, patient care will be affected. And our work is really to provide the optimum patient care. We want the best outcome for our patients. So incivility, the forms of workplace violence, when we say verbal, it takes many forms. One is verbal. Verbal abuse is gossiping, shouting, swearing. That is verbal. Non-verbal abuse would be eyes rolling, making faces, excluding another nurse from the group, or not talking to that nurse. And we also have passive-aggressive behavior, and that would be refusing to communicate to a nurse. That's passive-aggressive. Sabotaging a coworker, that's passive-aggressive. Then we have bullying. What is bullying, right? Bullying is accusing a coworker of someone else's error. That's an example. Or assigning an unfavorable work. For example, a charge nurse does not like one or two of the nurses, and she may give that nurse a difficult assignment, which is really not fair. And that's a type of bullying. And also we have expressing untrue critique. Since I have been precepting for many, many years, and I have been in charge of education in hospitals, various hospitals, sometimes I hear a charge nurse might say, oh, the new orientee, this so-and-so, he or she is not cut out for the job. I don't think that person has the skills, so I would tell them that is not the right way to approach a new orientee. We really have a requirement. We have the responsibility to teach, and it's all about ethics. Because what is ethics? Ethics is about rights and duties. We have the right to teach, and the orientee has the duty. We have the duty to teach, and the orientee has the right to learn. And that is what ethics is all about. So as a preceptor, anyone out there who's a preceptor or an educator, please watch the signs of bullying, especially when it comes to precepting or education. So the key clinical considerations and outcomes, incivility impacts patient care, as I mentioned, and any form of workplace incivility is totally unacceptable. The culture of the workplace can lead to what? It can lead to it can jeopardize patient care, it can diminish teamwork, it can cause medical errors, which we don't want to happen, and it can cause sentinel events. What are sentinel events? According to the Joint Commission, sentinel events are events that happened because there was an error or a negligence or an over medication, any event, and that should be investigated as far as the root causes. So a sentinel event is an event that should never have happened in the first place. And it also reduces quality of patient care, and most of all, it lowers the morale and productivity of the nurses. So that's the reason why incivility, workplace violence is a very big thing. And what happens after that? There's a greater turnover of nurses. And what happens with greater turnover? Well, nurses are burnt out, they leave the profession altogether, or they might ask for a change in another unit. But if everything happens, the same thing happens, then that nurses will say, why am I a nurse anyway? I don't need this. And then they leave, right? So we have to recognize what workplace violence is. And for all administrators right now, the best protection employers can offer to anyone and everyone working in their facility is to adopt a zero tolerance policy towards workplace violence against their employees, and that is important. And of course, the labor department will actually be there. If somebody reports that their hospital has bullying or incivility or lateral violence or anything, if they report that, labor comes in and labor starts interviewing people. That's the reason why the Department of Labor is very, very careful now. I mean, and OSHA is very careful now with the, incivility and bullying. All right. So the next item that is in my pyramid here is funding. All right. So we have a big shortage of nursing. What do? Well, nurses actually think of the expense, right? How can I spend for my education, right? Because we need them. So for funding, well, people want to go into the baccalaureate degree, correct? So for BSN, public institutions, the funding is around $9,687. For private institution, it's about $35,087. And sometimes they charge by per credit. So if it's per credit, it's $500 per credit in a public institution and $1,500 to $2,000 in a private institution. So these are the main things that I want to bring up. In my next slide, I have some solutions here, right? Every problem has a solution, correct? There's no problem without a solution. I am sure of that, and I know you know that. So the first one I zeroed in is the World Health Organization. What do? The World Health Organization takes a leading role in raising awareness for opportunities and potential of nursing, creating a political commitment and establishing a process for supporting the development of nursing, not only in the US, but globally. So World Health Organization is in charge of that. They make sure that all the countries in the world are knowledgeable, they know that education for nurses have to be supported in order to increase their potential. And that will take years. Change takes years. Change doesn't happen overnight. It will take years, but it can be done with the help of the World Health Organization. Then there's another one that I zeroed in, Title 8 of the Public Health Service Act. What is Title 8? Well, Title 8 of the Public Health Service Act has another name. It's called Workforce Development Fund. It's intended to increase the supply of nurses. So the government has this, and every few years they have to reappropriate the funds for Title 8. I'm also supporting that. I always write the senators and Congress, we have to have a voice in order to reappropriate Title 8. So Title 8 of the Public Health Service Act has provided money to nurses. There are 1,600 schools and colleges of nurses in the United States. And these 1,600 schools and colleges are recipients of Title 8. In other words, they get a piece of the pie. They have a piece of the pie, but they have to apply to the government and say that we also want to have monies for Workforce Development Fund. See, when a student goes to the school and her subjects are being assessed, et cetera, they're sent to finance. And when they go to finance will offer them all the grants and scholarships and everything they're entitled to. There's so many of them. And some students are more resourceful than others. Students look for their resources, and they're very good at that. But in the financial office, they will offer a student financial aid, which is Title 4. And Title 4, the students have to pay back in 6 months after graduation. All right. But of course, if they don't have a job, that's the problem, because the interest builds up. But with Title 8, if that student was aware of Title VIII, that student will tell the finance officer, well, I don't want Title IV, I want Title VIII. Now, if the school has the fund for Title VIII, they will give it to the student, right? Because this is from the government. So throughout 2019, more than $325 million was disbursed to all the schools and colleges for Title VIII. So people can go to their BSN school, master's, doctorate. I wish I knew that before I went for my doctorate. I didn't know that. I knew that in my doctoral class when we had a class on making policies, and we were supposed to look for problems and create the policy. There were only two females. Most of my classmates were males. There were 14 of us, but I was the only nurse. Most of my classmates were directors of their own colleges. They were one was a senator, previous senator, but they actually were in education already, presidents and vice presidents of their schools and colleges from different states. And I was the only nurse. I was supposed to look for my own problems, the problem in nursing. And I found out, funding is a problem. Lack of faculty is a problem. So then I bumped into Title VIII, which I didn't even know existed. I could have used it for my own doctorate, right? So then I worked on that. So when I have classes in my organization, I always tell the nurses about Title VIII, and many of them have graduated using Title VIII fund. They did their baccalaureate, they did their master's, and I'm so happy that it worked for them. But that was my role. My role was like, hey, let me tell you about this secret fund. It's not a secret, but people don't know about it. So it's a secret if they don't know about it, right? So I start telling them about it because it is very important, because the difference between Title VIII and Title IV is that in Title VIII, if nurses here in the US use that for school, when they graduate and they show the U.S. Department of Education that they work in an underserved area, there are underserved areas in the United States, believe it or not. So if they show the government that they work in an underserved area, they can apply for loan forgiveness. So this is a type of loan that has forgiveness. For faculty, if faculty have used the Title VIII during their student years, when they did their doctorate, then they can write the government and say, I am a faculty now, so I'm solving the faculty shortage. I'm faculty now, and so I am applying for loan forgiveness. And they will be given loan forgiveness as long as they have a letter from the dean stating that they indeed are faculty members in that particular school or college. So there's always a breath of fresh air when we do our research and we find out what are the funds that are available. And I'm talking about the perspective in the United States. I don't know about the Philippines. I know that in the Philippines, you have your laws and everything, so you probably will tell me, right? So in last year, they had to reappropriate, because every few years you reappropriate the Title VIII, and it was reappropriated. It won, and it was approved bipartisan. Both Democrats and Republicans approved it when it was reappropriated, and it's still there. It's going to be there until 2024. So after 2024, they have to reappropriate that again in order for the Title VIII to be active again. So the second one is to focus on continuing education. Yes, continuing education is very important. As I mentioned, nurses always look for more, for credentialing. And of course, they get more money also if they're credentialed. But the most important goal in credentialing is for yourself, like validating your own knowledge and practice, saying that, oh, I'm a credentialed person. Like I've been in critical care for many years, so my credential is CCRN. And then when I started, because I've been teaching so much, the CCRN credential, my credential is CCRNK, and the K is for knowledge, so that there are credentials like that. So the next one is preceptor training. As I mentioned earlier, preceptors have to be trained in order to be teachers. You know, you might be a seasoned nurse, you might be the best nurse in your unit, but if you don't have the teaching principles, if you don't know how to impart or transfer knowledge, you're not going to be a good teacher. You're not going to be a good preceptor. You might be good in the classroom, but not in the clinical setting. So a preceptor is a mentor, she's a coach, is a role model. That's what a preceptor is. So when I did my doctoral in nursing, my doctoral in education rather, I did my EDD. My dissertation was the impact. What is the impact of preceptor training on effectiveness of preceptors in delivery of knowledge and skills to nurse orientees? When I did that, I gathered data in 4 hospitals, 2 hospitals that gave preceptor training and 2 hospitals that did not give preceptor training. And what was I measuring? I was measuring 5 items. I wanted to know knowledge, I wanted to know if they were good in evaluating. I wanted to know interpersonal relationship, nursing competence. What else? There's 2 more, but I had five items to measure. And believe it or not, well, personality is one. And believe it or not, from the nursing data and the preceptor data, the 5 items I was measuring really stood out as significant. It was statistically significant based on all the data I gathered. I remember my dining room table was full of data. I wanted to do my own before I put it in SPSS, but I wanted a quantitative data so that I could say this is really evidence-based, that preceptors, if they are trained to become preceptors, they become effective preceptors. See, when you precept someone, there's that teaching moment, a very special moment, the preceptor, the learner, and the patient, the 3 of you in one. So that's a very special teaching moment. It's not just the preceptor or the student, but the patient is there, so we always have to have that art of teaching. And the next item, masteral doctoral pursuits, is very, very important for nurses to keep going. Lifelong learning is important. Masters and doctorate. I actually did mine not too early because I couldn't, since I have a child with special needs, so I love so much. I have 4 daughters, and my 3rd daughter, Andrea, is the love of my life. She's a child with special needs, so she's 24/7 actually. So I really couldn't do my master's and my doctorate if it's all study, because when I study, I really study to 2 a.m. I cannot cut short my studying. So it had to be done later on when I had the time to do it. So that's the reason why you're wondering, why did I do my master's in 2010 and my doctoral graduated in 2014? That's because I really had to wait for that time when I could do it. But it is worth it. And I always tell my students, go for more education. It's so important. It's just really, as I said, a breath of fresh air when you have that aha moment and you can say, oh, this is what I learned and it is so important. Now I can impart to my students or my colleagues, most of all. The next item here is nurse entrepreneur. There's a paradigm shift. I said earlier that credentialing is important because there are specialties in nursing, but there's another paradigm shift. Nurses have decided to be their own business. Well, wait a minute, I can be in business. So I have students, since I have a company for continuing education, I talk to my students about this. And now some of them have their own business. They are vascular nurses. They have their IV company. They go to home care and start an IV, and they charge fee for service. So many nurses have gone that route also to become entrepreneurs, just like lawyers. You see their name on their door. Attorney Matthews, that's his own business. Same thing, nurses can be their own business. So I realized that being clinical, I loved clinical. At the same time, I love my business because I started it without any feasibility study. I just did it out of a gut feeling that there is a need for education. But then I was doing 2 things. I was doing education and I was doing cardiothoracic. And one day my husband told me, wait a minute, you have to stop. I want you to choose. Is it going to be your clinical or is it going to be your education? I'll give you 1 week to decide. If you don't decide in 1 week, we're all going home to the Philippines. I said, why? Well, because you're going to die young. You're doing your cardiothoracic, which you love so much, and you're doing your business. You know, one has to give. You have to choose one. So I decided, well, I've had loads and loads of clinical experience. Let me focus on entrepreneurship to actually be an educator and impart my clinical side into the classroom. And that's what I did. But every now and then I could sneak something, like I would go to the hospitals and precept. If the directors call me, they tell me, oh, my plate is full. Can you help me in post-anesthesia care? I would go and spend a few months, but not full time, you know, just in and out. You know, but that was okay. So anyway, policy making is the other one. Policy making, position statements are very important. There are so many organizations of nurses, right? I mentioned ANA, American Nurses Association, that's one of them. But all these organizations of nurses, they actually look into the problems and find solutions and then make a policy. So policy making, it is in our role to become policy makers as well. So we have to engage ourselves in policy. And I've already talked about workplace violence. Oh, that's one important thing, elements of healthy work environment, which I'm going to talk about in the next slide. The elements of healthy work environment can solve our problems in the workplace and make it a happy workplace. And that was spearheaded by AACN, the American Association of Critical Care Nurses. You'll see that in my next slide. But the next one here, I want to tell you that the congressman from Connecticut, Congressman Courtney, came up with this bill about workplace violence prevention for healthcare and social service. And this bill is supposed to stipulate that employers should have a healthcare a workplace prevention policy to avoid violence, to protect healthcare workers and social services. And this will cover nurses, physicians, EMTs, social workers, everybody involved in healthcare. So this was approved recently. I have a date here. In April 2021, just recently, the Workplace Violence Prevention for Healthcare and Social Services, known as HR 1195, passed Congress, bipartisan, but it still has to go to the Senate. All right, so it has to be discussed, and I hope and pray it will pass the Senate. But so far, right now, the OSHA, you know what OSHA is, right? OSHA is under the Labor Department. They already have steps in place to avoid workplace violence, and they have outlined it. And one of them, I'll give you what OSHA stipulates. To provide safety education, they provide safety education to employees so they know how to conduct themselves, and they know that disruptive behavior is not acceptable. There's also provision that they have to have cellular phones. They have to be equipped with cellular phones, and they have to have handheld alarms just in case somebody harms them. They have to be ready. And it also requires to prepare a daily work plan and keep a contact person involved of their location throughout the day. That's an OSHA requirement. Another one, employers provided vehicles, like if people had to go from one place to the next, that should be an employer provided vehicle, and that should be maintained. And another important thing is the employees should be instructed not to enter any location where they feel they're unsafe. That's another stipulation. And the buddy system. You always have to have a buddy system at work, somebody who needs to know where you are. That's very, very important as well. And we call it an escort service. And also police assistance. And in potentially dangerous places like home care. There are nurses who work in home care. They are escorted if their patients in home care are in places that are dangerous or high risk. They have to have an escort. And once they're in the home, if they think that there's a danger of harm to them, they can actually refuse to do their work and leave. And that's another OSHA regulation. So many, and workers' right to refuse to provide care. That's what I mentioned. And so, but nothing can guarantee that we are safe. There's no guarantee that we are safe. We can be a victim anytime, in any place, even in the workplace. So when we say workplace violence, it's not only your colleagues, it's usually the patient, the patient's visitors, the patient's families. That's what we mean by workplace violence. Okay, so we have to learn, OSHA says, learn how to recognize, avoid, and diffuse potentially violent situations. And supervisors have to be alerted about such. So we have that organization which is under the Department of Labor, and that is OSHA. All right, so the next slide is going to be what are the elements of healthy work environment, which was started by AACN, and we have to know that we all have to practice that in the workplace in order for us to be very effective in our nursing care and always get that optimal patient outcome. One is skilled communication, authentic leadership, and skilled communication are so important because you need to communicate to the next nurse or to your nurse manager. And if the nurse manager is an authentic leader, he or she has to do something about it and not just leave that complaint on a piece of paper. All right. Then effective decision making is very important through collaboration. We're collaborating with the healthcare team. What I love about ICU is that every time the team visits the patient, you have a voice. They actually ask the nurse, what do you think? And you can actually say, well, Dr. So-and-so, these medications were not working last night. The vital signs are this and this. I think we need a change. And then they say, that's a very good idea. What do you think? What should we do now? So in other words, the nurse is really a part of the team. And that's what I enjoy about being in the United States as a clinician, a clinical nurse, because they call you. They ask your suggestions. They ask you to, why don't you start this? One time I was called because the intra-aortic balloon pump didn't work and the patient was losing blood pressure and there were surgeons there. Oh, can you please call Marie? We need to fix this. So you are so important as a team member in rounds because we have a voice. So then appropriate staffing, that's really hard. Structure standard says ICU should have 1 nurse to 2 patients, open heart, 1 nurse to 1 patient. And of course, telemetry, 1 nurse to 4. But it's not always the ideal, especially now with a big shortage. So we have to really come to a compromise. But of course, the largest crisis now is shortage. So what happens with appropriate staffing, right? That is in limbo now because of the shortage. So right now they're offering so many sign-on bonuses. The sign-on bonuses have even went up to $25,000 just to sign on as a staff because there's really a big shortage. I just read about it today. What? $25,000 sign-on bonus just to sign on? So it really is a dire need. It's an emergency, especially in places where COVID-19 or the Delta variant has lambasted or slammed so many places. And one is meaningful recognition. Let's recognize our nurses. Meaningful recognition means you have a nurses' day, you have a nurses' week. Let's recognize our nurses for what they do and not just recognize the managers, right? It's so important. So these are the healthy work environment. My next slide is showing us embracing diversity. Look at all these people. They all come from different places, right? This is what makes up healthcare. Healthcare is so diverse. So we have to know that we have to have workplace diversity because workplace sensitive. We have to have, cultural sensitivity and cultural diversity classes. We have to understand, for example, I had a patient from Korea. One patient from Korea was already crying, and I was the director of the education. So I went to the nurse, the beds, and I looked at the paper. What pain medication have you given the patient? And the nurse said, well, none. I said, why none? Well, then every time I asked the patient on a scale of 0 to 10, what is the severity of your pain? She just nods her head. She's not saying anything. I said, she's from Korea. She actually will not complain. They will just start crying. So whereas another patient for just a pain of 1 to 2, they'll already be crying. So every person has a pain threshold. So we have to know what's the culture in the Philippines, what's the culture in Japan, what's the culture in Korea, Indonesia, China. How do these people express pain? You have to really know that, because they will not tell you right away. But when they're crying, what is that? It's a pain of a 10, right? So that is so important. All right. So I'm sorry I'm talking fast, but I know that you have questions. So this is my last slide. I just wanted to show you that I had to go to Washington, D.C. That's my husband, Romy, who's always by my side, and I couldn't have done this without him. So you know, I went there as an advocate because I joined Voices 2019. Here's Voices 2019. Voices 2019 was organized by APIAHF, Asian Pacific Asian Pacific Islander American Health Forum. That's APIAHF. So they organized that, and I got a scholarship for that to go to Washington, and they practiced us on meeting look for your problem first and meet the senators or the congressman and discuss it. What is your problem? How do you ask it from them? You know, it's so important. We have to have a voice. And this is me in the office of Senator Schumer. You know, that's his assistant. We were waiting for him to come. I needed to discuss with him what I wanted to discuss, right? And I think it was immigration. Wanted to talk about immigration of nurses from the Philippines to the US. So that is one of the things I wanted to find out, if there was a quota, how many green cards are allotted for every country, you know, things like that. And this one here, of course, you don't see them because it's actually covered. These are the leaders of APIAHF. That was a very, very nice seminar. We were there for 3 days in a hotel, and we kept going to Washington, D.C. And after that, I've had several trips to the Capitol just to actually also meet with the senator. So I did go to the office of Senator, the Vice President now, Kamala Harris. She was a senator at that time. She wasn't there, so I just dropped off a document that I wrote about the history of the Philippines, why there are so many nurses here, and what we were asking for. So I dropped that in her office. But we did have a nice conversation in the office of Senator Schumer and the other Senator Durbin. So we did our best. So that's my story. So anyway, these are the references if you needed to see anything there. But thank you for your time. It was a pleasure. I enjoyed being here and listening to Dr. Buhat and Dr. Somana about their lectures as well. Thank you. Thank you, Socorro, for inviting me.
You're most welcome, Marie.
Thank
Thank
you.
you, Dr. Ortaliz. Your insights on nursing issues in the United States are truly remarkable. And now for our third resource speaker from
Thanks.
China.
I'll stop share. Where's the stop share here? I don't see the stop share.
Thank you, Dr. Ortaliz. And now for our third resource speaker from China, I would like to call on Ms. Shasha Li, Associate Professor of Huzhou University, for the introduction.
Good morning, everyone. Thank you for giving me this opportunity to introduce speaker, Jiayuan Zhang. Jiayuan Zhang, she comes from China, medical PhD, registered nurse, the lecturer of Harvard Medical University. Her research expertise is psychological and physiological mechanism and the intervention of psychonomic disorders. She has been committed to investigate the influence factors and develop community-based health management research among the youngest in China. In recent years, she has participated 6 research projects from the National Nature Science Foundation of China. She has published 12 papers as the first author, of which 6 papers were included in American Science Citation Index. Now, let us welcome Dr. Jiayuan Zhang.
Thank you so much. Can I see my screen? Good morning, everyone. It's my honor to share with you as a reporter. The theme of the conference is International Trends and Issues in Nursing. So I want to share the trends of psychological nursing in China. And my title is the Hotspots and Frontiers Analysis of Psychological Nursing Research based on the site space. Next, please. Thank you. And I was deeply moved by a famous quote by Florence Nightingale, who said, "The object of medical care is not cold stone, wood, and paper, but human beings with blood and life." And in my opinion, the essence of nursing work is care for life and soothe the mind. So next, please. I will introduce my contact from two parts. Part one, overview of nursing psychology. Part two, the hotspots and trends of nursing psychology in China. Okay, next. The part one, I will introduce an overview of the nursing psychology. With the development of the biopsychosocial mode, modern nursing has gradually changed from patient-centered mode to human-centered holistic mode. It involves the whole life cycle, the whole process of healthcare, and the nursing service extend to communities, families, also pay more attention to the whole life. The dominant concept, holistic nursing mode, is patient-centered. In the service context, it attaches great importance to the psychological nursing. So the important position of psychological nursing gradually stand out. Next, please. As an important branch of nursing, nursing psychology is widely used in clinical nursing, nursing management, nursing education, community nursing, and other fields. And the research object of nursing psychology is gradually expanded from patients to family members, nurses, nursing students, and other groups. And the scope of clinical application is more and more extensive. Next, thank you. So, therefore, in order to comprehensive and deeply understand the research context, objective and application field of nursing psychology in recent years, I used the site space to analyze the hotspots and frontiers and future development trends in the field of nursing psychology in the past 6 years in China to provide reference and guidance for nursing scientific research, education, and clinical workers. The SiteSpace is a visual analysis software based on Java platform developed by Professor Chen Chao Mei of Drexel University in the United States. Through this software, knowledge map can be drawn to understand the historical process, current hotspots, and future development trends of a certain scientific field. And in this study, we select the CNTI database using psychology as a search term, retrieve the papers published in 10 core nursing journals from 2015 to 2020, and used the SaaS-based visualization software to perform analysis of distribution of annual publications, high-frequency keywords, recall keywords, and electro. Next, thank you. So first, let's see the trends of annual publications. The results show that in the short term, the Annual number of articles show a slight fluctuation trend. In 2020, the number of articles published peaked at 569. Next, please. Thank you. And then let's look at the keywords colonial visualization atlas. We can see that keywords are a cautious and coarse summary of the topic information and research content of an article, and the high-frequency keywords reflect the research content focused on this discipline area, namely the current research hotspot satisfying the high-frequency keywords of current research through co-occurrence analysis of keywords in a certain discipline area over a period of time and explore the top 20 high-frequency keywords. Let's see as the tables. Okay, thank you. Next, please. And the top 20 high-frequency keywords, we can see that in the tables. The first three was the qualitative research, quality of life, influencing factors, psychological relations, mental care, mental health, coping style, social support, COVID-19, psychological intervention, breast cancer, psychological capital, correlation, experience, elastic, elderly, pain, PTSD, that is the post-traumatic stress disorder, mental state, self-efficiency. And the top three high-frequency keywords were qualitative research, quality of life, and influencing factors, which reflect the hot contact of psychological nursing research in recent years. The first, qualitative research, was an important research method of psychological nursing. At the same time, more and more scholars pay attention to the quality of life of the research object and investigate the influencing factors of the research. Next, thank you. And in addition, the COVID-19, breast cancer, and elderly are the disease and groups concerned by psychological nursing in recent years. Next, thank you. And what's more, SAT-space can detect the changing trends of word frequency so as to understand the research frontiers and changing trend of this subject and grasp the future research direction and health issues. Therefore, on the basis of keyword co-occurrence analysis, I conducted breakout word detection analysis and generated 18 high-frequency breakout words, including the onset here and intensity of breakout words. And the breakout words from 2015 to 2017 were nursing intervention and compliance. And two breakout words were job burnout and intensive care unit from 2017 to 2018. And then 4 breakout words were ICU nurse, psychological distress, and meditation effect from 2018 to 2020. And these keywords correspond to the research frontiers and evolution trend of nursing psychology articles published in nursing journals in each year. Nursing psychology research, the group of concern gradually expanded from patients to patients with close contact with nurses. In addition, it focused on the special environment of the ICU to explore, discover, and solve the existing or potential psychological problems of growth related to the intensive care unit. as well as the specific meditation effect, potential possible mechanisms and cause behind the psychological pain and psychological distress. As we can see, in recent 6 years, the research trends of nursing psychology with qualitative research, quality of life, and influencing factors as hot topics are ICU nurses, psychological distress, and meditation effect. The intensive care unit is the major disease for centralized monitoring, treatment, and care of the special ward. Due to the patient in a critical condition, a series of psychological happens after getting into the intensive care unit, cause nerve rhythm of ICU nurses' work, affect the quality of work life, occupational stress, and risk for post-traumatic stress disorder is significantly higher than ordinary ward nurses. In addition, the ICU working environment is relatively closed under the high intensity workload and demanding working standards. ICU nurses bear great psychological pressure and are prone to mental health problems. Therefore, the research trend of predicting nursing psychology will focus on the mediating effect among ICU nurses, psychological distress, and specific problems, pay attention to and explore the quality of life and related influencing factors of relevant groups, and better dig analysis and solve problems through qualitative research. In this study, we provide the visual analysis of nursing psychology articles through SaaS-based software to show recent nursing psychology field research situation, hotspots, and cutting-edge trends. It provides reference for the related staff engaged in nursing psychology research, and the research results of nursing psychology could be better applied to the clinical nursing-related fields, enhance close cooperation between scholars and institutions to further promote the development of nursing psychology. And the nursing service mode should be reformed to provide high quality and appropriate nursing services for patients, promote patients' rehabilitation and regression, and fully reflect the spirit of humanistic care. And that's all the contact. Thank you. That's all. Thank you. Thank you for attention.
All right. Thank you, Dr. Zhang, for your updates on psychiatric nursing in China. And we are finally done with all our 4 speakers. So from our keynote going to our resource speakers, everyone has actually had a very informative input of the current trends and issues in nursing worldwide. So what is a webinar without a question and answer portion? So our open forum is actually open already. So to all of our participants through Facebook Live and YouTube, kindly comment your questions through your chat boxes, through your comment section, and our committee heads and members will be the one to filter them for me. They will be the ones to deliver them to me later. All right, so speakers, kindly turn on your cameras. We already have a few questions coming from some of our members of our nursing community during your talk. All right. So good morning once again to our dear speakers. All right. So this is actually a question that can be answered by any of our speakers. So for the first question, why are there still people or why are there still nurses who actually bully other nurses, or if not, they're young, as you would call it, they're junior nurses? And how do the junior nurses or the management deal with this particular situation? Dr. Buhat, I think you
Yeah.
may
Okay.
give
Can you
your
hear
input.
me?
This was your question. Yes, Dr. Buhat, we can hear you.
Yeah. Okay. Actually, the violence in the workplace is are various. You know, it's not only the we in the Philippines we really call it bullying. It in so many ways, but there were studies on nurses to nurses bullying. There are studies of that also includes the first line manager or the unit manager or the head nurse, we call it, bullying a staff nurse or among them, and also the supervisor. So within nursing profession, there is already what we call bullying. So I can relate that, you know, in those are the result of the studies on my graduate students. And I can relate that because of one factor is the multi-generational workforce. The time of the veteran, the boomers or the older or the more senior, during their time, teaching, the way they teach is sort of bullying on the present time. You know, they take it personally, while the one who is giving the coach or the mentoring or the teaching does not think she's bullying a person. No, so it really depends upon the situation. But I think one is I will repeat is the multi-generational workforce. So therefore, as an administrator or the leadership in nursing should have a redefine the functions of the nurses, redefine the functions of the preceptors, the mentors, and the coaches, and handle it with notwithstanding the different traits and characteristics of the individual person. So it's a more of personalized guidance or talking, communication with the person who is being bullied. Another one is there should be an organized committee or a sort of a team that handles those who complain. So they can complain anytime, and that can be handled respectively. Because if it's in the nursing, within the nursing, it's the same. It's the bullying again. You know, it's the more senior. But if it's a multidisciplinary team that handles the grudges of those complaints who are being bullied, then that can be more objective. Bullying is not only among nurses. Bullying also is from the doctors and the nurses, the family of the patient themselves, you know, especially those in the private rooms, you know. So, I think a clear policy and can limit this, and it should also be included in the orientation program on how to handle people who are being oppressed or suppressed of their needs. Maybe others can also answer. Thank you.
Thank you, Dr.
Hi,
Buhat, for that input.
I have an
Yes,
answer.
Dr.
Thank you,
Ortaliz.
Dr. Buhat. I have also an answer for that. In the United States now, it's zero tolerance in the hospitals. So when the nurses complain, they can complain, and that complaint goes to HR, and then it can go to labor department, and that becomes a big issue. So the employers have stipulated now a zero tolerance on bullying. Yeah, so.
Can I add on? Can I add on?
Yes, of
I
course.
forgot to mention, I had a study on the bullying also in the workplace. And actually, it's the doctors who bully the nurses. And when I presented that in the occupational health, the doctors rally against me. And they don't believe the research. And I said, well, this is a research study. I'm sorry, but it's very evident that you're bullying the nurses, you know? So I just want to share that it's very evident in the workplace, especially in the ICUs.
Thank you, Dr. Buhat. Thank you, Dr. Ortaliz, for that, for your input regarding workplace bullying among nurses. So, yes, this is actually very much relatable because a few years back, I was able to read an article, and it actually says in particular, it's the quotation that really got to me. It's nurses eating their young. So it's most of the time the senior nurses who are actually bullying the more junior, the more neophyte nurses in the unit. So thank you for that. All right, so I think we have a few more questions here for our roundtable discussion. So this is actually, I think Dr. Buhat will be able to relate to this because this is something that is more situated in the Philippines. Government nurses are now enjoying the approved salary standardization. How about nurses working in the private hospitals? Why can't they get the same benefits like that of government hospitals?
Yes, that is very evident in the Philippines because there is a standardization law, the Appropriation Act, in the government. So the government follows what is in the law. And in the nursing law, it's salary grade 15. So therefore, we are upgraded to salary grade 15 as an entry level. How about the private hospital? The private hospital is dependent on the owners of the hospital. But there is a House bill now that also would mandate the private hospital to increase the salary of nurses at par with the government institution. But I was able to discuss this with the PHAPI organization, or the Private Hospital Association. These are the owners of private hospital. And their question is, we cannot afford to pay our nurses that much. So therefore, our solution is, it depends on where you are. Let us say if you're in Metro Manila, what is the living condition in Metro Manila? If you are in Cebu, or if you are in Baguio. So it depends upon the living conditions of in the place where you are, so they can adjust the salaries of the nurses in their area. Up to this time, the owners of the hospital is looking onto and working towards also increasing salaries of nurses. Most of the hospital now are thinking, are the benefits not enough? Should it be a basic salary? The basis of our nurses rallying is the basic salary. It's not the benefits. But in other hospitals, they have a very good benefits. If you sum it up, it's almost like the salaries of the government hospital. Young nurses now doesn't like the benefits because they just stay in a hospital for 2, 3 years or 4 years and they move out. They go to other country. They go to America. They go to Canada, Australia or Middle East. So the benefits is not very encouraging for them. It's actually the basic salary. So hopefully the House bill will progress to become a law and to adjust also the salaries of the nurses in the private areas. Did I answer the question?
Yes,
Thank
yes,
you.
Dr. Buhat. All right. So I think maybe our other speakers can also address this particular question. Maybe Dr. Ortaliz would like to share her point of view about us. The government nurses are now actually enjoying the approved salary standardization. However, our private hospitals here in the Philippines are still not able to give the same compensation package. How does that work in the United States? How do they actually facilitate it in contrast to that
Yeah.
of the Philippines?
Right. Well, they have every hospital has its own starting salary for new graduates. And then every year they have what you call the anniversary pay. And then on top of the anniversary pay, they have the credentialing pay, which is all embedded in the paycheck. So every year their salaries go up. So every hospital has a different base. So
So
I
at
guess
least
I guess the new nurses start with 75,000 a year. That's a new grad. And then the following year, it just keeps going up because of anniversary pay and their credentials. And plus across the board pay if the hospital decides to give an across the board pay. So
Can I add more?
of course, Dr. Buhat.
Actually, I was talking with owners of the hospitals, and they said what limits them, because I was actually suggesting of standardization by a salary grade, salary grading system to have a unified and a more equitable salaries, like a starting salary after a year or two, having a career path, and the competencies also increases. So you have to increase your salary because of the there is a certification program. So if you're certified critical care, then you should be receiving this much. And they said, yes, we want that. So I help them in the framework and on the implementation policy. However, the issue here is most of the private hospital has a union. And in the union, there is a union bonus and everything. And the disparity of salary on seniority matters a lot. Because if you are in that hospital, even if you don't have competency, and if you are a member of the union, your salary increases because of the union. So that also is a factor to consider by our nurses in salary of the private hospital. Thank you.
All right. Thank you, Dr. Buhat. All right. So I have another question here. This is actually for Dr. Ortaliz. One of our viewers wants to ask regarding the credentials of nursing graduates. Are there actually is there actually a means in particular, if you are aware or knew, if no actual clinical experience due to pandemic will still be accepted for taking the NCLEX NCLEX exam in the US? I think this is if whether or not they can still take the NCLEX examinations in the United States.
Yes, they
If they can still
can.
go abroad despite it.
Yes, it depends on the laws of the country, your country, how the nurses are. Sometimes POEA, they have factors to deploy nurses, whether allowing or disallowing. So there's always a change every few months. Like in 2020, I think there was a deployment. They stopped it for a while because of the fear of COVID. We didn't want the nurses to leave the country because of that. And then after a few months, they opened it again. So there's always, there are factors that disallow or allow them to come over. But they can take the NCLEX here, but that depends on if they left the country. Some people are already here, or some people even studied here. Some of the nurses from the Philippines, they came here to study here. They took the NCLEX. So I don't know how they did it. I guess their parents had green cards or they were petitioned. So yeah. So as far as immigration, it's a complicated matter. But I was actually involved in actually writing to senators at one point because there was a visa, like 25,000 immigrant visas available, and for that, and that should have been distributed to people in all countries. And they were talking about how is it going to be equitable. They had to have a ratio for every country and not just favor one country. So yeah, that was something that they were talking about. So that hasn't been concluded yet. It has to go through a hearing. That's what I meant. But thank you for that question. That was an interesting one.
Thank you for that, Dr. Ortaliz. Yes, I think there are actually some of our Filipino nurses are actually interested of going abroad already, but are actually afraid of acquiring
Can
clinical
I
experience or
add
bedside
going to
experience.
New
Yes, of
York?
course, Dr. Buhat.
Yeah. In the Philippines, there is a recent development wherein our Department of Labor is proposing that there will be no more national licensure in the Philippines, because anyway, the licensure in the Philippines is not necessary if you apply in other country like America. And there were position papers by the organizations in nursing and the nursing leaders that we still would like to have the licensure examination in the Philippines, despite the need of other country, that they don't really care if you are licensed in your country or not. However, I said that the primary qualification of going abroad is your experience in nursing. They are not going to hire you if you don't have the experience, unless you are already in America and you're a nurse, and they probably can hire you. But to migrate, to go and apply while you are in the Philippines, apply in other country, they need experience for you to be able to qualify. Thank you.
So so the Professional Regulation Commission is still in charge of that, right? For the requirement as far as taking the exams as soon as graduation.
Yes.
Yeah.
Yes.
It can be complicated because Filipino nurses are in 50 countries in the world.
Yeah.
50.
Exactly.
So every country has their own rules. So that's what they have to investigate.
Yeah, I was invited in a roundtable discussion for the international graduate nurses in United States, and this has been an issue of hiring them, but still the primary reason of hiring is the credentials or the experience that they had in their own country.
Yeah, that's true.
All right, thank you for that, Dr. Buhat and Dr. Ortaliz. So moving to another question, but actually this is just a previous question about bullying, but to be addressed to our viewers. Would like to know what your views are regarding workplace bullying and if it is being experienced in Indonesia and China. Dr. Zhang.
Okay.
Hello.
Hello. Yeah.
Yes. Good morning. Our viewers on Facebook Live and YouTube are asking if in China there is such a thing as workplace bullying and what do managers do about it?
Okay. I think the epidemic also has a great impact on the mental and psychological status of medical staff, including most of the nurses are suffering from the mental problems. The prevalence rate of medical staff was significantly higher than of the non-medical staff, especially nurses. And the research shows that half of the medical staff have the depressed symptoms and had the anxiety symptoms or the insomnia symptoms, and some even has the stress disorder. But in China, the government has given the psychological support for the mental health to medical staffs, such as giving the lectures. Most of them are the online form, and then the psychologists will support them to help the nurses to self-help and counseling for medical and related staff. And medical staff can support and encourage each other actively self-help and learn the knowledge of self-care, listening to the audio, video related to mental health, effectively manage emotions, maintain a good psychological state, improve work efficiency. And that's all. Thank you.
Thank you, Dr. Zhang. How about Professor Somana? Is workplace bullying actually evident in Indonesia? And what do our nurse managers or what does the hospital do about it?
Okay, thank you for this question. In Indonesia also might be similar with another country. When they occur bullying in the hospital for the nurse, we can assess first what problem about bullying, and then maybe discuss about the head of nurses, and we can regulation depend on the hospital, and then after that. We can make the solution. What the appropriate of the solution depend on what do bullying occur, and then maybe the hospital have regulation about this and give punishment for the nurses when the nurses malpractice or another problems. So I'm sure about what's bullying. Maybe if I positive thinking, maybe not bullying, but maybe the senior have more experience and to give discipline for junior, maybe something like this. Depend on what the problem with this bullying. Maybe like this, Mr. Justin.
All right. So thank you for that input, Professor Somana, regarding workplace bullying. So maybe it's a matter of taking things either positively or negatively, depending on the approach. Yes. All right. So it actually varies culture per culture, I guess. There are some cultures, of course, that have a different point of view regarding it. And of course, there are some that actually put in with regards to rigorous and harsh training being equaled to that of better training compared to that of a kinder approach. All right. So actually, I believe this actually wraps up our question and answer portion for this activity. So on behalf of the committee heads and our class, thank you very much for being with us this morning. I know you are all very busy. Thank you, Dr. Buhat, Dr. Ortaliz, Professor Somana, and of course, Dr. Zhang. So now let us proceed to the presentation of certificates of appreciation to be done by our mentor, the Dean of the Philippine Women's University School of Nursing, and our subject professor, Dr. Minerva de Ala.
Thank you, Justin. Can we start for the keynote speaker? Okay, where's Dr. Buhat? Dr. Buhat.
Hello.
Yeah, can you open your video, ma'am? The camera.
Yeah, I am open.
Okay. Okay, the Philippine Women's University, the Graduate School of Nursing, hereby awards the Certificate of Appreciation to Dr. Maria Linda Buhat for her invaluable contribution in the advancement of nursing practice by sharing her expertise as the keynote speaker during the webinar event entitled International Trends and Issues in Nursing, given this 25th day of September 2021 at the Philippine Women's University, Manila, signed Michael Justin Valles, the Program Committee Chairman, John Oliver De Leon, the overall webinar chairman, and yours truly, Dr. Minerva de Ala, the Dean of the School of Nursing. Congratulations, ma'am, and thank you so much.
Thank you. Thank you, everyone.
Okay, to Dr. Ann Somana, okay, the Philippine Women's University, the Graduate School of Nursing, hereby awards the Certificate of Appreciation to Dr. Ann Somana for his invaluable contribution in the advancement of nursing practice by sharing his expertise as the resource speaker during the webinar event entitled International Trends and Issues in Nursing, given this 25th day of September 2021 at the Philippine Women's University, Manila. Signed, Mr. Michael Justin Valles, the Program Committee Chairman, Mr. Jan Oliver De Leon, the overall webinar chairman, and yours truly, Dr. Minerva De Ala, your Dean of the School of Nursing. Congratulations, sir, and thank you so much.
Thank you so much for Dr. Minerva. Thank you.
Thank you. Okay, to Dr. Marie Ortaliz. Okay. Okay. The Philippine Women's University, the Graduate School of Nursing, hereby awards the Certificate of Appreciation to Dr. Marie Ortaliz for her invaluable contribution in the advancement of nursing practice by sharing her expertise as the resource speaker during the webinar event entitled International Trends and Issues in Nursing, given this 25th day of September 2021 at the Philippine Women's University, Manila. Signed, Mr. Michael Justin Valles, the Program Committee.
We lost
I
the
think I can
volume for a
continue.
while.
Yes, I can
Yes.
continue for Dr. De Ala while she's not around. So
I
allow me
see.
to present this certificate of appreciation to you, Dr. Marie Ortaliz, for your invaluable contribution in the advancement of nursing practice by sharing your expertise as our resource speaker during the webinar event entitled International Trends and Issues in Nursing, given this 25th day of September 2021 at the Philippine Women's University, Manila. Signed by yours truly, by Dr. Jan Oliver De Leon, our overall webinar chairman, and our dean, Dr. Minerva De Ala. Thank you, Dr.
Thank you very
Ortaliz,
much.
and happy birthday.
Oh, thank you. Thank you.
And of course, let us not forget our speaker from China, Dr. Zhang. So the certificate of appreciation is hereby awarded to Dr. Jiayuan Zhang, MD-RN, for her invaluable contribution in the advancement of nursing practice by sharing her expertise as a resource speaker during the webinar event entitled International Trends and Issues in Nursing, given this 25th day of September 2021 at the Philippine Women's University, Manila. Signed by yours truly, Dr. Jan Oliver De Leon and Dr. Minerva De Ala. Thank you,
Thank
Dr.
you.
Zhang.
Thank you. Thank you very much.
Thank you once again to our resource speakers. And now allow me to read the citation for our certificates of attendance for our attendees in Facebook Live and on YouTube. So first, allow me to read. The certificate of attendance is hereby awarded to the attendees for having attended. This will be adjusted to a 3-hour webinar event entitled International Trends and Issues in Nursing, given this 25th day of September 2021 at the Philippine Women's University, Manila. Signed by yours truly, Dr. Jan Oliver De Leon, our overall webinar chairman, and Dr. Minerva De Ala, our dean and professor. Thank you once again to our resource speakers. And now to show our appreciation, the presentation of the token to our keynote and to our resource speakers. May I call on professors of nursing from Far Eastern University, Daryl Jake Fornolles and Rosario Stephanie Ornum.
Okay, so in behalf of all the students of Philippine Women's University, we thank our speakers for sharing your expertise. Please accept a simple token from all of us. In compliance with COVID-19, your tokens will be delivered by courier. Once again, thank you.
Thank you.
Thank you.
Thank you.
So the gift is actually a surprise. It's going to be wrapped if ever. So thank you so much for
Thank
that.
you.
All right. Thank
Thank
you,
you.
Ma'am Steph and Sir Daryl. Thank you to our resource speakers. Our most sincere gratitude for for you to being able to attend this morning. So now
Thank you
for
so
our
much.
attendees, this will be your webinar evaluation links. It is now posted on your comments section in Facebook Live and on YouTube. Kindly accomplish them, kindly fill them up for us to be able to furnish your webinar certificates. Kindly allow us also time to be able to send your certificates as an overwhelming number of attendees have filled up our 3 virtual spaces. And now to formally close this session, to give us our closing remarks for this event, may I call on the Dean of Review and Academics and Services Director of Dr. Carl E. Balita Review Center, Philippine Women's University Associate Professor, and the overall webinar chairman of this event. Let us call on Dr. John Oliver Z. De Leon.
Yeah, thank you so much, Sir Justin. And greetings in peace, health, and happiness and prosperity amidst this pandemic. To our guest speakers, I would like to thank you and give my warmest gratitude to Dr. Maria Linda Buhat, Dr. Maria Ortaliz, Dr. Jiayuan Zhang, Mr. Prof. Somana, and of course, for PW President Marco Alfredo Benitez for gracing our event, Dean of School of Nursing Dr. Minerva de Ala, VPAA Dr. Felina Yang, the faculty members, the committee heads, the students of the Philippine Women's University School of Nursing, and all the participants of our events, a blessed morning amidst this pandemic. Well, I would like to start this closing remark with gratitude, the feeling of giving thanks. Please tell yourself right now that you are blessed, and please type in the chat box. Please type "Thank you, Lord" in the chat box, or just "Thank you." Okay, go ahead, kindly do it. Everyone who's listening to me right now, because we have to be grateful. We have to be grateful for waking up, for learning, for having another day or another chance in life and love. Well, let us thank Him for another day and a wonderful life. Whatever we have right now, we owe it up to Him. And let us continuously pray for His will to be done in our lives. And to our fellow nurses, today we talk about international current trends and issues in nursing in the Philippines, USA, Indonesia, and China. The nursing profession is always under different dilemmas and changes. Nursing is constantly evolving and changing, with nursing education following suit. Currently, nursing practice must adapt to disruption from external factors like the pandemic, technological advancements, and socio-cultural issues. This and other factors are driving to these trends in the nursing profession. So nurses, we must adapt for us to grow and be better in our profession. Knowledge development, competency building, and lifelong learning are some of the key gears that we need to equip ourselves in order to adapt, for us to be adept and agile in this ever-changing world. Also, I think what we must have is integrity, the transparency in what we think, what we say, and what we do. Let us always see the positivity in things, as well as giving the rational and ethical weighing of our daily nursing activities, from the nursing practice, nursing education, nursing research, up to nursing administration. Today, again, thank you for giving us your hearts, ears, and minds for all the learnings about current trends and issues in nursing that enriches our mind, body, heart, and soul. To all of you and the rest of the team, thank you so much. Sheshani, terima kasih, salamat. Don't forget to stay safe. God bless and mabuhay, everyone.
Thank you, Sir Janos. And indeed, nursing, changing as it is, we must adapt and be challenged and be the best that we can be. We started this right, and we shall also end in the right way. To close this session formally, may I call on nurse entrepreneur Ms. Elfa Marie Base for our closing prayer.
Let us bow our head and feel the presence of our Lord Jesus Christ. Heavenly Father, as you have brought us together and molded us into a productive children of yours, as we come to an end of what we have accomplished today, may the learnings we have gained serve as the catalyst for us to move forward, influence, and educate others. To see growth in our lives, may we continue to live recognizing your presence in that you are the God of love, of all wisdom. May you give us the right path for us to continue the best version of ourselves to serve more and love our neighbor. This we pray in the name of the Lord. Amen.
So for our acknowledgements, this webinar will not be possible without the help of the following: Mr. Marco Alfredo Benitez, our University President; Dr. Minerva de Ala, the Dean of the School of Nursing and our Professor in the Current Trends and Issues in Nursing course; the different departments of the Philippine Women's University, from the Information Technology Department, the Communications Technology Department, Broadcasting Team, Web Administration Team, and the Admissions and Marketing Department. And for the webinar committee, thank you so much to Dr. Jan Oliver De Leon, our overall webinar chairman, yours truly, Mariel Sevilla, Arvin Baez, Daryl Fornolles, Mary Ann Neri, RB James Abonalia, and Ms. Alma Aksalan. And to the rest of the Philippine Women's University Doctor of Philosophy and Nursing students who are currently taking the Current Trends and Issues in Nursing course with Dr. De Ala. Thank you so much for taking part on this momentous occasion. To close this webinar, let us all sing the Philippine Women's University hymn. To all our participants in all our virtual spaces, thank you very much. Have a nice day. God bless, and let us all keep safe. And to all our current trends and issues in nursing classmates, kindly proceed to Google Classroom Meet link to meet with Dr. De Ala. Thank you and have a great day ahead, everyone.